All right, good afternoon, everybody. Thank you for being here. We have an exciting day on the floor today. We're taking up some really important bills for the state of Wisconsin, such as keeping public safety, helping out with healthcare costs, and some other very important bills. Some will be passed with strong bipartisan support. Some may not, but we believe they're very important for the state of Wisconsin. That being said, when we go to the floor, there will be a moment of silence for the lawmakers and their families in Minnesota from that tragic incident. I think you guys all saw our joint statement over the weekend. Political violence is never the answer. We need to solve our differences through legislation. So obviously our thoughts and prayers are with the families affected. We're happy and thankful and grateful for the efforts of law enforcement in Minnesota for their swift action and the federal government for catching the suspect in a timely fashion, so that way we can all at least breathe a little more sigh of relief. But with that, I'm going to turn it over to Senator Teston to talk about a bill that I once authored. So apparently we needed a new bill author to get it across the finish line. So Senator Teston.
Well, thank you, Leader Lemieux. I'm really excited today about Senate Bill 258, which is the APRN Modernization Act. This is legislation that has been around for 13 years, and really what it aims to do is to empower our advanced practice nurses to operate at the highest level of their scope of practice. Now, I had the opportunity to author this bill the last two sessions. In fact, it was the first time that this bill had actually made it out of the legislature and got to the governor's desk. Unfortunately, that bill was vetoed the last two sessions, but this go-around, we worked with the governor and the various stakeholders to come up with an agreement where I think not everyone's 100% happy with the outcome, but the most important thing about this is that we are having our advanced practice nurses move in the right direction. And this is about empowering our providers to do the jobs that they were trained to do, which is take care of patients. This is going to help underserved areas in every corner of the state. Our APRNs have done a phenomenal job, and if there was one silver lining that occurred during the pandemic is that some of the restrictions were actually removed. And now, hopefully, once this is passed out of both houses today, when it reaches the governor's desk, we have a tentative agreement that this will be signed into law, and we will become the 29th state that has enacted the APRN Modernization Act, which has ranged from both blue and red states. And I want to thank my colleagues on both sides of the aisle for making this day come to fruition. It's been a long time coming, and I really want to give my hats off to the nurse groups who have really been they've done a lot of legwork on this bill, and it's been a long time coming, and I'm really happy that it's going to get to the governor's desk and become law. And so with that, I want to turn it over to Senator Julian Bradley to talk about some of his bills that are up today, and thank you.
Thank you. Well, good afternoon, everybody. Today, we are very excited to have another bill come through, our portable benefits bill. Portable benefits, if any of you have seen the beautiful billboard trucks driving around, reminding everybody of the broad range support that we currently have for portable benefits and the idea. This will be a first in the nation concept. What we are doing is opening up portable benefit accounts and allowing portable benefit accounts for drivers in our gig economy. So think Uber, Lyft, Instacart. Now, we're excited about portable benefits, everybody. Portable benefits allows gig economy drivers to have portable accounts that follow them. It allows them to remain and hold on to their independent contractor status, but while still getting the benefits of having an account that they can use for qualified expenses. And what we're talking about is healthcare, additional earnings, retirement, other things that as regular, normal employees for an employer, we qualify for, but independent contractors don't. We're removing that red tape, we're enabling them to do that, and those accounts get to follow them. The independent contractors will get to keep the independence that they desire the most. That's why they do this. If you think back to the pandemic, as Senator Teston was talking about with APRNs, think about how we got our groceries. When the governor shut down the state, many of us had to rely on these delivery services. Now, we've got their backs, and we're going to help them out. So we're very excited for that today. Looking forward to bipartisan support. We know that we have it, and hopefully it passes out of both houses with bipartisan support, and we get the governor to do the right thing and sign this bill. Up next will be Senator Jesse James.
Thank you, Senator. Thank you for being here today, and let me shine a bit of light on some of the bills we have on the floor today. As chair of the Committee on Mental Health, Substance Abuse, Children and Families for the past 2 sessions, I'm encouraged to see bipartisan efforts finally highlighting the importance of supporting our youth. Now that Governor Evers has declared this the year of the kid, I have committed substantial effort to developing policy initiatives that prioritize the needs of our youth. The following are several examples of that work. First up, we have SB 106. This establishes psychiatric residential treatment facilities within our state, an urgently needed step forward in caring for our most vulnerable youth. The bill is a result of the study committee on emergency detention and civil commitment of minors, which I had the honor of chairing. The committee brought together bipartisan legislators and experts from across Wisconsin to develop policy recommendations. Among our top priorities was the establishment of PRTFs. PRTFs provide intensive psychiatric treatment in an environment that is less restrictive than a psychiatric hospital, yet far more structured and supportive than outpatient care. For children and teens who are struggling with mental health challenges at the most vulnerable time in their life, PRTFs can be life-changing. Another bill we have brought onto the floor today focuses on protecting vulnerable youth, is SB 232. This bill addresses our Child Advocacy Centers, or CACs. CACs serve children who are involved in cases with alleged abuse, neglect, and endangerment by providing resources and support, while also aiding in the investigations for these cases. Not only do CACs provide a supportive and welcoming environment for the youth, they also add in forensic interviews and other services for local law enforcement. Recognizing the importance of these centers to Wisconsin, we crafted this bill to support the establishment of 2 more CACs in our state. I applaud our child advocacy centers across our state who are our most valuable partners when it comes to holding those accountable who prey on our most vulnerable, our children. Lastly, we have SB 41, which continues the school safety grants program the legislature established a while back. It's all too often that we turn on the news and see the headline of another school shooting. These tragedies break our hearts and crush our communities. In recent months, we've seen all too clearly that this can even happen here in Wisconsin. Thankfully, there are proven ways to help our kids. Investing in physical infrastructure, things like reinforced doors, shatter-resistant glass, cameras, and providing security training to staff. This bill establishes a one-time grant program to assist even more Wisconsin schools in improving the safety of their buildings and providing security training. We need to ensure that our Wisconsin schools have the necessary tools and resources needed to create and maintain a safe learning environment for all of our students. I'm committing to fighting for our youth because far too many of our challenges are facing silence, and that demands action, not indifference. I look forward to continuing these efforts with bipartisan support so we can provide a safer and brighter future for our kiddos in Wisconsin. Thank you very much, and I'd like to turn it over to Senator Corey Tomczyk now for his remarks.
Thank you. Senate Bill 184 is a combined redraft of Senate Bill 212 and 213 from last session. They passed, those bills passed out of the Senate and the Assembly, but they were vetoed by Governor Evers. There have been states and municipalities across the country that have taken steps to outlaw the sale and use of vehicles and devices based upon their power source, fuel, or energy they use. In 2023, our neighbor Minnesota introduced legislation that would ban the sale and use of common gas-powered devices like lawnmowers and snowblowers. This bill would restrict Wisconsin governmental units from taking that same course of action. It is clear that existing limitations, increased costs, and even more importantly, consumer preference means that moving away from traditional technology is not suitable, not always practical, or not always affordable for residents of the state of Wisconsin. No state agency or local municipality should be able to provide a blanket ban on the purchase, use of commonplace, reliable, affordable technology. This is a perfect bill. This bill restricts the government. It does not restrict the people. Thank you.
Thanks, everybody.